whenever you're ready.
Okay, great.
All right, good.
All right. All right. We're talking with Dr. Alex Crosby of the Centers for Disease Control and Prevention. Dr. Crosby, what are the statistics and demographics of suicide?
Well, one of the things we've noted about suicide over the past few years in the United States is rates have continually been going up, and especially since about 2005, every year up until 2014, that's our most recent data, but every year suicides have been going up in the United States from 2005 to 2006, 2006 to 2007, and it's especially been going up among working-aged adults, especially those in their 40s and 50s.
Mm-hmm. And gender? Is there a gender breakdown too?
Yeah, we definitely see that suicide rates are higher among males, and so that has been historically the case in regards to suicides. But what we've seen over these past few years in the United States is that rates have been going up among both males and females. Still, rates are higher among males, about 4 times higher than among females, but both groups have been showing increases.
Mm-hmm. And why do you believe that suicide is a public health issue?
We really believe at the Centers for Disease Control that it's a public health issue because of the ramifications of suicide and the consequences of suicidal behavior. It is one of the leading causes of death in the United States, the 10th leading cause of death. It also is responsible in terms of suicidal behavior for a number of non-fatal injuries, and also the consequences in terms of families, in terms of communities, in terms of what happens for our society when we lose someone due to suicide. And we also believe that public health has some tools that are important and useful in trying to address prevention of suicidal behavior, from the foundation of science to the emphasis on prevention to other things that the public health, and when I talk about public health, kind of the broad aspect of public health, in terms of many different disciplines that are taking a role in trying to prevent suicide across the country.
And how prevalent are guns in suicide?
When we look at deaths due to suicide, that about half of the suicides in the United States, the mechanism or the method was a firearm.
And what can science do regarding suicide?
I think one of the things that science can do in regards to suicide is helping to understand the patterns. For a long time, because suicide was oftentimes associated with mental illness, and mental illness had a stigma to it, there was a lot of mystery about suicidal behavior, whether it could even be prevented, what were some of the factors that played a role in suicidal behavior. But as science has started to look at suicidal behavior and began to systematically look at the issue, what we found is that suicide can be prevented, that there are certain risk factors that are associated with suicidal behavior, and that intervention can occur, and that there are programs that are successful in regards to suicidal behavior. So understanding the patterns, knowing what are the risk and protective factors, being able to develop programs, evaluate those programs to see how they work, and then take that information and then spread that to communities. I think that's where science comes in regards to understanding suicidal behavior.
And what guidance do you have for journalists?
I think one of the things that journalists can definitely help is that suicide is oftentimes a newsworthy event, but there are ways in which journalists can help carry the message of prevention as well as carry the message about what may have occurred in regards to a suicidal event. The message about prevention, the message about resources in communities, the message about what communities are doing. Even though someone may have been lost to suicide, there are things that are going on in the community in which they are making a difference. And so I think the journalists can work with those that are subject matter experts, those that are working in prevention programs, to help make sure that the message of suicide prevention and that there are things that can be done is getting out to the public.
Thank you, Dr. Crosby.
You're quite welcome.